We're back with today's checklist, and if you have been sniffling, sneezing, eyes watering, then we don't have to tell you that allergy season is upon us, folks. And here to help us prepare and battle the symptoms, allergy and immunology specialist, Dr. Purvi Parikh. And Dr. Parikh, full disclosure, I've had allergies. I've had allergies for years. Are you doing that for a fact?
That plant?
Are you serious?
Good timing.
Wow.
I'm sorry.
That is, wow, we love it when a plan comes together.
Yeah.
But like Dylan Dreyer, I too have bad allergies, and I was just picking your brain going into this segment. I mean, it feels like this season's worse than previous, but is that just a feeling, or is that actually happening?
It's not just a feeling, it's true. So progressively, seasons have been getting worse with climate change. As it gets warmer, the pollen seasons start earlier. And as greenhouse gases rise, like carbon dioxide, plants feed off of them. So not only are the pollen seasons longer, but also stronger. They become super pollinators. So the pollen counts are much higher, so people have much worse symptoms. This year is especially bad because we had such a warm winter. I started seeing patients coming in February, which is a good 4 to 6 weeks before we normally do.
Environmental versus seasonal.
Yeah, so people think seasonal allergies are only pollen, but there's so many other allergens that are there all year round. So dust mites, mold, animal dander. Some people suffer with these symptoms all year round. And also, it's not just one season. So spring is a big season, but so is fall. There's a different type of pollen called ragweed that surges in the fall.
So allergy season is essentially year round.
Yes, exactly.
All right. Well, let's talk a little bit more about, because I've heard before that allergies are worse depending on where you live in the country. As someone who grew up in South Carolina with a lot of pollen, I feel like my allergies have actually gotten worse since I moved to the Northeast.
Yeah, it varies, you know, because now many areas of the country that typically weren't bad are getting worse. But yes, traditionally the South and Southeast have much higher pollen counts because of warmer climates. Usually the Southwest used to be safe, but with climate change, even that is changing. And Northeast is tricky because we have every season, and then the cities, actually with the air quality and air pollution, can sometimes make the Northeast worse, too.
So there's no part of America that's immune. That's what I'm hearing.
Nothing is safe.
Okay.
Well, Chanel's been sneezing over here, too.
I know, I'm like,
She's a little quieter than I am.
It's almost like when you yawn, someone else yawns.
I hope it's just allergies.
Let's talk about symptoms of allergies.
Right.
For me, it's my eyes, but...
Right. So they can range from very mild to actually very severe.
Yeah.
So people may not realize that it's not always just mild things like itchy, watery eyes, runny nose, nasal congestion. Some people can get full rashes.
My little sister.
Yeah.
Yeah, and asthma really bad.
Asthma, too. So hives, eczema, and the asthma, people don't realize that link between allergies and asthma. So actually, allergies are the most common cause of asthma, which can be deadly. We still have 11 deaths a day in this country from asthma.
Really?
Wow. Yeah. So this time of year, we see an increase in ER visits for asthma attacks, hospitalization. So it's not always mild.
Okay, so with that said, then I guess it's time for Dylan.
Yeah, let's talk about what we can really do about this. What are some proven remedies that work?
Right. So some simple things you can do is stay indoors when the pollen counts are the highest. So that's usually early morning. So close the windows early in the morning. If you run outside or work out outside, you might want to opt to do that indoors during those seasons. And when you come home in the evening, change your clothes, rinse off, wash your hair, because you can actually bring the pollen with you.
And then you're living with it.
And you're breathing it constantly overnight, too.
What about over-the-counter medications?
So there are some great over-the-counter medications. Antihistamines are our #1 way to combat allergies, but the 24-hour ones work better, and they have less side effects. So some examples of those could be Zyrtec, Claritin, Allegra.
That you take every day.
Exactly. And that actually works better than Benadryl, because that has more side effects and is shorter acting. The nasal sprays are excellent, too, such as nasal steroids and antihistamines, but stay away from decongestants. They can actually make your allergies worse over time and have a lot of side effects. So the D part of Zyrtec D is not good to take.
At all? You shouldn't take them at all? Or just...
You can take them for about 3 to 5 days.
Sorry.
But then,
as someone who takes Zyrtec D, I got...
But you don't want to make a habit
Zyrtec.
of it. Yeah, exactly.
Okay. It's super helpful. Thank you so much.
Thank you for having me.
I've tried acupuncture in the past as well. Is that effective?
Yeah, so acupuncture is one of the few natural things that do have some evidence and data behind it. Interestingly enough, us allergists do something called desensitization on a daily basis. So we use dilute doses of what you're allergic to and actually train your immune system to stop being as allergic. Yeah, so it's almost like, hair of the dog. No pun intended.
I have not.
It's like what they do sometimes for nut allergies.
It's extremely effective. effective, and it actually makes you less allergic over time.
Oh, that's really interesting. We should do a story on that.
Really great. Thank you so much.